also a 12% rise in the fatalities from the COVID, just under 50,000 at 46.6 thousand in deaths, compared to the figures of November 2022. The countries which have been leading in this regard have been Japan, South new infections, which were reported in December 2022. Just in the last week of, especially in the last week of December 2022, but the earlier figures which I mentioned was the whole month. Now, in the last week of December 22, there were more than 3 million. I mentioned and at least 10,000 new deaths which were reported. Although in this last week of December, there was, compared to the earlier weeks of December, there was a reduction, a 22% reduction in terms of new cases. Talking about week 52 of 2022, the last week of December. Now, in this last week of December, new cases reduced in all the the countries which we have mentioned earlier, except in the people's 5%, and deaths increased by 48%. As many of you would be aware, there have been several reports of overburdened hospitals in the People's Republic of China, and also crematoriums and other burial places were also said to be quite over. This is the situation which has caused a lot of panic in various parts of the world, including among some of us in South Africa. As a result of these developments, a number of countries imposed special requirements for travelers coming from the People's Republic of China, tests of less than 48 hours for all travelers from the People's Republic of China. Amongst those countries, the 12 is the US, UK, Canada, France, Taiwan, the Philippines, Spain, Italy, a negative PCR test, plus also a test on arrival in their countries. While Morocco is thus far the only country which we know of which has imposed an outright travel ban on travelers coming from China. The rest of the world has not changed their position, indicated that we had not imposed any new requirements for travelers to and from China. Here in our country, on the 7th of January, the Genomic Surveillance Unit at Stellenbosch University, which is a member of the network for a specimen which was obtained from a patient on the 27th of December 2022. So even though the announcement was made on the 7th of January, this specimen had been obtained from a patient on the 27th of December. Private laboratories. So that's why the time lag between the collection and the reportage of this XBB.1.5 subvariant. The specimen was submitted to the genomic surveillance as a random sample of the Western Cape, because this was a random sample which was submitted for genomic sequencing to the laboratory at the Stellenbosch University. So what do we know at this stage? What we know at this stage is that the SARS-CoV-2 in the world at between 97 and 98%, major changes in the makeup of the virus, that it then the Delta and then the Omicron variant. That's Omicron has had more than this. So Omicron remains the dominant variant of concern throughout the world at between 97 and 90 variants or sublineages, since it started to dominate the COVID-19 environment late in 2021. The Omicron subvariant is also dominant in the People's Republic of China in the form currently of a subvariant called 97% of the circulating variant of concern in the People's Republic of China, which are the subvariants of Omicron. The XBB.1.5, which was detected in Stellenbosch, percent of the circulating subvariants. It is also, again, to emphasize that it is also a subvariant or a sublineage of the Omicron variant of concern. So while the various subvariants or sublineages have shown different levels in severity of illness. I think I want to emphasize, therefore, that while you would hear that this and that subvariant, it's more transmissible, thus far there's been no indication of change, major change in terms of severity of the infection. Reported overwhelming of the health facilities in the People's Republic of China and high deaths is the recent opening of restrictions, allowing people to travel more freely after a prolonged lockdown. There's been prolonged lockdowns, which means that there's very limited natural immunity. And also, there's also apparently in some areas of the People's Republic of China, limited vaccination, especially in the rural areas and in the small towns. So that explains the situation. So at this stage, I want to emphasize again that even in the People's Republic of China, in a huge population where people are now traveling freely, both in the country and also able to travel out of the People's Republic of China. We believe that the fact that the dominant variant of concern in China and in the world, this puts us in a better position and in less risk. And that is why we have not seen up to this stage any major changes in our epidemiology in terms of the rates of infection, also in terms of admissions to hospital, and even the rates of WHO, the World Health Organization in Geneva, and also the regional office in Brazzaville. And in both cases, the advice that we have received is that there is no need to impose any travel restrictions. We impose any restrictions internally in our own country. We have, however, been advised to take the following measures, amongst others: to increase the rate of testing. That is, that we must encourage people who experience the known cough, amongst others, but also symptoms such as body aches, tiredness, loss of appetite, and also at times loss of taste, and even sometimes diarrhea, that when we do experience any of this, and sore throat, just to mention, our practitioners in health facilities, including in the private health facilities, to order either an antigen test or a PCR test. And if the antigen test is positive, then a PCR confirmatory test, HLS and NICD, so that it can be forwarded to a number of tests and also the pool of sequencing specimen available. We need to increase surveillance. So the NICD will also increase in this regard wastewater testing for COVID-19, including also from aircrafts coming from high-burden countries. Currently, this was 1.5, the aircrafts coming from the US and any other country which also emerges as a rising, infections. The aircrafts arriving from those countries will also, the wastewater from those aeroplanes would also be obtained, samples of the waste subject that also to genomic sequencing. In this regard, I've already signed a letter a few days ago to all provinces. I hope MEC Mbombo, I hope has received that, and your office. And we've sent a letter to all provinces and laboratories to increase COVID-19 with that we must step up our communication and also our messaging to encourage more South Africans, those who have not yet vaccinated, to come forward, and also those who have not yet received boosters to come forward. Our vaccination Ministerial Advisory Committee, the boosters. So we're looking at the VMAC is looking at including in the boosters not only the people over 50, but also all adults from 18 years on upwards. And this, we expect this is which we need to take, increasing surveillance, testing, and also increasing the levels of vaccination and messages and communication for vaccination. These measures were presented to the National Coronavirus Council, chaired by the President. They agree that there is no need to either bring in any restrictions for travelers or even any new restrictions for the country. So as I conclude, I want to again emphasize that vaccination remains the bedrock to protect us against any. So that is the message which we want to give to the people of our country. Thank you very much, Coordinator, Mr. Foster Morale. Thank you.
Thank you very much, Honorable Minister, for that update that the public has been waiting. It is one of the specialists who we've been working with throughout the pandemic to make the inputs as far as the NSH is concerned. Over to you, Doc.
Right. Good afternoon to everyone. I just wanted to provide a little bit more information on the new variant. And I think really just to say that this is not unexpected. New lineages, new variants, and with Omicron, there are many subvariants of Omicron. And so the detection of this XBB.1.5 is not unexpected. It has been detected in many other countries. It's been in the US since October. And while the proportion is increasing there, it does not mean it will become the dominant variant elsewhere. We've seen with some of the other subvariants that a certain subvariant dominated in the US, whereas it didn't become dominant here. And there's quite low levels of this in Europe at the moment and in other countries. There are many people in our country who've been exposed to the different variants or subvariants of Omicron since it was first detected at the end of 2021. And so I think there does not, although there is some evidence that it may be slightly more transmissible than that, but even if there's a small increase in transmissibility, as with other variants, we have seen that vaccination and prior infection and high levels of population immunity presentation, it has not been causing more hospitalizations. So, and that we know what works for COVID and what has worked for us over the last years, as the Minister has outlined. And just to also note that through our wastewater surveillance, we're to monitor that as well. Thanks, Minister. That's just all I wanted to add.
Thank you, Dr. Michelle. I'm not sure if colleagues they want to make the inputs. We've got Dr. Bamford, we've got DG, we've got the Deputy Minister before we shoot straight to media questions. DG, any input? Dr. Bamford, the Deputy Minister, any input? You are muted, DG.
No, nothing from us. From my side, the Minister has covered us.
On that note, I'm going straight to
DG.
Want to say something?
I agree with the DG. We are covered by the Minister. Thank you.
Okay, wonderful. I'm going to take the first batch of media questions and send back to the Minister and the panelists to assist with the responses. The first, we've got about 11 questions. We'll take the second batch later. The first question is, please, will you advise when will the children aged 12 to 17 their second Pfizer vaccine, so it will be appropriate if they can be offered the third booster dose? Second question, why are the vaccines still being pushed despite overwhelming evidence that it does not prevent transmission or becoming sick? Third question, fourth, travel, the fourth, putting more travel requirement at this stage. How many cases? I think Minister did touch on this issue, but we can feel free to emphasize once more. Question number four, why are we taking advice from WHO and other I believe the panelists will be able to respond, but we've been working closely with the WHO. Question number five, when will the department start conducting informed consent workshops regarding these experimental treatments? Next question, is there a change in the you may come to work? If symptomatic, you can work remotely. So are there any changes with regards to this protocol? Next question, what is the Department of Health's view on the recent peer-reviewed paper by Dr. Asim Malhotra on the specialists, the experts like Dr. Michelle, Dr. Bamford will be able to assist? Last three questions, are booster shots booster shots open for those who are vaccinated more than 6 months ago. We did announce at some point late last year that we'll be opening for additional booster shots. I believe Dr. Bamford will be able to advise on the questions. Is heterologous boosting still an option more than one vaccine type, since this may confer stronger immunity? The last question of the first batch: is government lobbying for lower costs of vaccine, not only for us, but for other developing countries? So this is the first batch of, so I'm going to hand over back to the minister to assign the panelists to assist with these questions. Over to you, Minister.
First up, could we, maybe I might be the only one, the question about the peer-reviewed paper of a certain scientist. It might be, you are muted.
Okay, yes. Yeah, I sent you some of these questions, Minister, directly through your WhatsApp. Can check them. Yeah, just to repeat, C. Maholtra on the dangers of COVID-19 experimental vaccines. So apparently there was a peer review, the viewpoint of view from the Department of Health. So you understand the question before you respond. Back to you, Minister.
Okay, let me just try and see what we can, who can assist us here on the boosters. Why, I think the questioner was saying, why are we pushing vaccines when they are shown not to prevent disease and illness? And maybe Dr. Michelle Groom could also say something. Take advice from WHO. I can deal with that. Again, DG and Leslie Bamford could possibly just deal with this, because anyway, it's as if we don't have informed consent currently. But again, on protocols changes, DG can deal with that. Whether we have indicated, I'm also not familiar with this. So we could, I don't know if Dr. Michelle Groom might have some knowledge, or less shots. I didn't get the full question. And also about bivalent vaccines. Maybe again, Dr. Leslie Bamford could could comment on that. Let me just deal with the ones which I said I can quickly deal with, and then the colleagues can also pick up the ones. The question of why and the reason we're doing so is because the vaccination has proven beyond reasonable doubt, beyond any doubt, in fact, since in terms of a variant, starting with the Omicron and also its sublineages, have resulted, even when there's been high transmissibility, has been resulting in milder. Indeed, vaccines have proven to be effective, not in terms of preventing one to be infected, but many of us who have been vaccinated, even as things, were able to also on a weekly basis show the difference. Even at the height of the Omicron, fourth wave, we could show that. And we have indicated that's far only one specimen was found to be, testing positive for this subvariant. Thus far, in terms of reported, and as I've indicated, this was a random sample. With random, once it is picked at the random basis to an individual, because it was a sequencing sampling which was done on a random basis. So there was no possibility of contact tracing and that it could be possible to check whether there can be more of this variant at this stage. There was a question about why take advice from the body which is recognized by, if not all countries, members of the United Nations. There might be one or two countries which may take that position. We know that even confident that the WHO is the body with the necessary mix and other major health challenge. One on lobbying for reduced prices, definitely. We have been doing that from whether at WHO, at bilateral meetings, at various fora, including the G20. So that is definitely what the question of making sure that the technology, if we have the necessary know-how, we can be able to do so. But also, this will also, allow prices also to be reduced. Let me then, DG could also come in. Thanks, Foster.
Thank you, Minister.
Foster, shall I come in and answer some of the questions related to the vaccination program?
Yes,
please go ahead. Yes, yeah.
I think the questions that were assigned to me. So first of all, a question about booster doses. So as people are aware, adults 50 years and older receive 3 doses. So it is our intention to offer an additional dose. So that will be a 5th dose for people 50 years and older, and a 4th dose. Booster doses will be available during January, probably towards the end of the month. But additional doses will also be available for people who are immunocompromised. So we are combining those doses. So those doses will be made available to all adults. We will continue. Already our booster doses are heterologous booster dose, and we will continue to offer the heterologous boosting. With regards to the bivalent vaccines, we do not currently have been asked to review and make recommendations with regards to whether we need to give any consideration to switching from our current vaccine. Are not yet registered in South Africa, so we certainly have no immediate plans to introduce them. But as I've indicated, our scientists, our scientific advisors regarding booster doses for children 12 to 17 years of age. As you know, that age group is eligible to receive 2 doses of the Pfizer vaccine. Recommend that we provide booster doses to that age group based on an understanding that the protection provided by the 2 doses should be adequate in this age group. Those were all the questions that were assigned to me. So let me hand back to the program director. Thank you.
Over to DG.
No. Thank you very much. Thank you very much, Minister. And thanks to the colleagues and symptomatic and asymptomatic. So we have not changed those protocols. So the status quo remains in terms of that. And then when it comes to the issue of informed consent, ethical clearance for that kind of work. And as a department, we work quite close, not experimental work. That's why the vaccine question is misplaced. But for any other, it wouldn't go through SAPRA, it wouldn't go through the ethics committee.
Thanks very much. So I'll just touch on the issue of the peer-reviewed paper. So I think this is a paper from evidence and many papers supporting the use and safety of COVID-19 vaccines, and has been, they are minimal compared to the effects of COVID-19 disease itself, and compared to some of the minimal side effects from the vaccine. It's a body of knowledge, and there are many papers available, and so to single out a single peer-reviewed paper, so I would just encourage participants to just have a look widely in terms of the literature that's available. I think we've detected this one case. There most likely are other cases of this variant. There's very little known. It doesn't give us much information. This variant has been detected in many other countries. It wasn't detected here first. It was no way to control them. They will move with the movement of people. And we saw, the restrictions that were in place on South Africa spread very quickly throughout the world. And so the detection of this XBB variant in South Africa really is at this stage, we're monitoring all the variants. We have many other variants, and we know that all the existing variants have had very good, the natural immunity, as well as immunity from vaccination, which we call hybrid immunity.
Thank you very much. Foster, before you go to the next batch, I think the only thing I can add to DG about consent is that as is indicated, the questioner suggested that before they could be rolled out. So we disagree on the experimental nature. But just to say also that for any patient site, they will be aware that before you take up the vaccine, it's explained to you, and then after that, you also have to sign to acknowledge that it's been a minor. It's the parent who provides the consent. So even though all in all, in terms of sign their own consent, but we have always encouraged that even for the 12 to 17-year-olds, that preferably the parents should be also present or have even children above 12 years in terms of medicine such as the vaccination. They are allowed to make their own consent. Thank you very much, Foster. I'm not sure if there's any come in. Over to you.
Thank you, Honorable Minister and members of the panel who assisted with the first batch of questions. The second batch is just in terms of time. The first question on the other journalists, they repeated the questions from the previous batch. We can just talk of Pfizer vaccine, an update on the expiry date of current stock of Pfizer vaccine. Second one, will we get a memo for COVID-19 guidelines update for change in testing guidelines? Third question, when will the age group receive their previous booster? Almost 12 months, so that immunity is waning. So I believe Dr. Bamford did touch on this. I hear someone is not muted. Let's first check who's the person so that let's see. Arnold, can you check who is not muted so that we can continue without any disruptions? Ms. Arnold? Yeah, as you try to mute the person who is muted, let me continue. Next question. I think, let's see.
It's actually Arnold that is not muted.
Arnold, can you mute? I've muted him. Okay? Let me continue. Apology for that technical disruption. The second one, another question: since the new variant was found in the Western Cape, can the MEC of the Western Cape, Doctor, have been reported? If the MEC is still here, I'm going to promote her to the panelist so that she can be able to assist. The next question: when will the additional dose is pointless without being allowed to get another booster? So this person is calling for those who are immunocompromised, especially the adults, to get additional booster shot. I believe Dr. Bamford will be able to assist on that. Next question: how many cases of this virus that it is spreading or causing an increase in hospitalizations, and how many might have, and how might the COVID vaccine booster program be tweaked? How many COVID vaccines are currently in stock in the country in total? Its own COVID-19 vaccine, The next question, can you provide an update on vaccine stocks currently available? No, this one is already been asked by another journalist, and also those who are expiring. So the total number of vaccine in the stock and those who are expiring together with the dates. Next question, how does the new variant impact the rules in office staff or businesses? Should the business reduce the capacity because of the new variant? The minister mentioned that the arrangements for additional booster for people 18 and above will be concluded within the next year. Dr. Bamford touching on the implementation date of additional booster dose, but we can just re-emphasize on that. Zandile Mieza from SABC News is asking, are there any further details that can be provided regarding the patient's profile of the individual who has tested positive within the patient's condition? And has this observation been informative in any way regarding the behavior of this particular subvariant in the human body? So this journalist, Zandile, is simply asking the condition of the first case of this variant. How's last few questions from that I initially reserved for the third batch, but I don't think there's a need to go for the third batch. We'll rather take all the questions. So the next question, the Minister of Health mentioned in his remarks earlier that the country will start testing wastewater from flights coming from China. Next question, has Gauteng province seen an increase in demand for vaccinations or boosters since the emergence the clinics and other vaccination sites coping, or are they seeing this week and people being highly mobile during the holidays? Will the government be pushing masking again, face masking again? Are there any updates to this effectiveness of face mask? What needs to, how many Africans check where they can get vaccinated? So on this one, we've got an app called www.findmyjab.co.za. So we are able to see your nearest vaccination site, the ones that are operational. So the very last question, can the panel respond on hunting vaccine? How many COVID-19 vaccines are currently registered with SAPRA in the country? So this was a very long list of questions. Members of the panel, if they feel that I need to repeat certain questions, I'll do that. I'm going to hand over back to the minister to assign these questions to the panelists.
Thank you very much, Foster. It's quite a long list. My numbering may also, okay, let me just, as the ones which you sent. So update on expiry dates, I think it also comes again somewhere down. I know Nicholas Crisp has been largely managing this, but I'm sure you will have the information. You can also just deal with the update on the vaccine stocks of the two vaccines which we have. The next one, provinces in terms of improvement of testing, but I'm sure DG could comment whether this would require follow-up memo, circular, also on amending some of the previous guidelines on testing. DG, you could, and then the next one, boosters below 50 years. I think Dr. Bamford has dealt with it, but she could come back quickly just to reiterate. And then the new variant in the Western Cape, I can say something, but I think I did explain in my earlier reporting, but I can come back to that. And then immunocompromised adults, when will they receive, eligible for their second booster? I think, again, I can again restate, and maybe Dr. Michelle Groom could also comment on it, on the number of the XBB. That was on 17 Omicron subvariant detect. How many? I think, yeah, the stock of vaccines, the question has got too many unrelated, including on stocks of, yeah, okay. The next one, so I'll deal with that. And then Dr. Bamford will start. But also both Dr. Bamford and DG, if they want to add on that, they're free to do so on our own vaccine capacity. Update on stocks, deaths and hospitalization, new variant, I think will be dealt with under 17. So 20 and 17 will be dealt with together. Arrangements for additional booster for people 18 plus. Again, Leslie, regarding the patient, I'll deal with this under question 17. Any key observations that were noted regarding the patient's condition? I think it also falls under 17. And then Dr. Michelle Groom can deal with that as to if I had it well in Gauteng. I'm sure, again, Leslie can comment on that issue of deal with the masks, whether we want to bring masks for children or adults when schools open. Vaccine sites still open. I think Foster tried to deal with that, but DG and Leslie could deal with that. Again, DG and Bamford could respond to that. Okay, I believe, Mr. Mohale, this will be the last. It's quite a long list, and I hope that this is the conclusion of the responding. So let me kick off that. Western Cape could comment. As I've indicated there, MEC Mbombo, if she's still on the platform and been brought into the panel, could say something. But we did say in our report that this was a random sample. So when you do a random sample, therefore you're sequencing, but not based on individual, but on the sampling. So that makes it impossible to know, and that's why we emphasize that it's possible. The patient might come from the Western Cape, but it's also possible that they may not. Comment on that. Now, I think on the 17 is the one where the question was whether how many cases. Again, at this stage, it's only one case from the more samples. Those who are positive, that they should be forwarded to through the NHLS and NICD to the genomic sequencing units, so that we can have bigger sampling. Evidence that it's spreading at this stage, because we only have one confirmed sample. There's no evidence pool to can actually see whether, in fact, there is any difference in terms of it is said to be highly transmissible from the countries like the US, as Dr. Michelle Groom indicated, but she could comment also on that. But this has not translated into any increase in severity and hospitalization. And then the vaccine stocks, Dr. Bamford will deal with. Whether we're developing vaccines in South Africa, the answer is yes with this. On the one hand, we have through Aspen Pharmaceutical on their licensing by Johnson & Johnson. They're not necessarily doing new vaccines, but I think Aspen itself is looking at partnerships over and above with J&J. But they do have hub, which is there in Cape Town, Afrigem, which is together with BioVac, working together in terms of the mRNA vaccine development. Afrigem has made quite some progress in terms of developing. The other vaccines will be produced as well. So that's the situation in as far as that is concerned. I think, Foster, I will stop there. The other questions, I invite members of the team. I think Dr. Bamford and DG have quite a few. I did invite Deputy Minister as well to tackle the issue, so he could also come in. Can we then pass over to the rest of the team? Thank you. You can start, Dr. Bamford.
Relate primarily to stock of vaccines. So I think approximately 10 million doses of the J&J, the Janssen vaccine, and 8 million doses. The doses expire at the end of March and the end of April. However, we do anticipate that the shelf life of the vaccines will be extended for a minimum of another 3 months. Expiring. The Janssen, the J&J vaccines do not expire until 2024, and in some cases 2025. There was a question about the pediatric Pfizer vaccine, the beginning of February. I think I did touch on the issue of booster doses, just to indicate that we anticipate that all adults will be offered another booster dose. We expect that this will take place. With regards to the immunocompromised, maybe just to reiterate, so we're trying to move away from number of doses. Any adult who has not had a dose in the past 6 months, whether they are immunocompromised or not, 180 days. And as I say, every adult 18 years and older will be eligible to receive such a dose. Have we seen high demand in Gauteng or in the rest of the country? So, of course, the first week and the week between Christmas and pick up now that we've entered the new year. But in fact, demand has remained muted. And we do really hope that with the new year, people going back to work, children going back to school, that people will come forth, particularly in the private sector, have closed. But we always advise people, if they are looking for a vaccination site, they can always phone our National Health hotline, and there are people available who will advise them as to where they experienced adverse events following immunization. We have systems in place to monitor such adverse events. We know that such events do take place, although they are uncommon. They are closely monitored, so that people who have suffered injury or an adverse event, a significant adverse event following immunization, will be compensated. Let me stop there. Thank you.
Thank you very much, Dr. Bamford, and thank you, Minister. On the guidelines, following the ministerial letter with the testing guidelines, that should have been distributed because I signed it quite late yesterday, so it should be out already and available through the provinces and the facilities. Just to add on the Norfolk committees that actually review the side effect, whether there is a causal link with the vaccine. And then when there's a causal link, then it then goes for adjudication by the Norfolk compensation scheme so that people can get the relevant compensation. The Find My Jab website, where people must just get into that website and it will give them, they put where they are, it will tell them which site is available and open in their area. Thank you very much. I will then hand over to
sequence so far. We are sequencing an weekly report, which gives an update of all the sequences that have been found. And so this usually, if we may detect additional cases, we will be monitoring that, and we'll be watching data coming also from elsewhere in the world in terms of looking at severity. But there's been no increased severity associated with this. And so the wastewater surveillance of the airline wastewater will most likely commence next week. But just to note that we're also putting out reports, those as well on our updates. And just to touch on one, I think there was one question, Foster, just on the measles, and just to say that we're also providing weekly updates on the measles outbreak. To you, Minister.
Yeah, so Foster, I think the last one is for Deputy Minister on the question of whether we're considering bringing back masks.
No, thank you very much, Minister, and thanks to the wonderful presentation that you have given to us. I'm always reminded when you are in an airplane, they always say the government has lifted the compulsory wearing of masks. However, it is optional now. Anybody in this plane who wants to wear a mask. But what actually has come up from Dr. Branford now actually does indicate that we are calling on South Africans to maybe 50 years and above to get another additional booster, the 18 to 45, another additional booster. But for the 12 to 17 years, no booster needed as yet. Actually, because this is one age group that is not really much stressed by the disease. So again, also saying, going to schools, there may not be a need to wear a mask compulsory. It was coming in from another caller that you called this meeting largely after consultation with the WHO, after consultation with our scientists. Now, we don't have any other body in the world that advises ministers of health and also governments on these issues. Now, that caller probably was suggesting someone else from those leadership, and this is just making the statement very authentic. What actually the minister has shared with us here today, that it is after consultation with these credible and experienced experts on health in the world, and also including those in our country. Thank you very much, Minister, and over back to Foster.
Thank you very much, DM, to do the formal closing remarks. I'm going to hand over to Minister to give us the parting shot before we hand over to Deputy Minister. Over to you, Minister.
Well, not a lot from my side, except just to re-emphasize the fact that they're not imposing any travel requirements, either to or from People's Republic of China or any other country. The fact of the matter, why it's important to have this kind of discussion, it's under control because of the measures which we know, especially vaccination. So again, we encourage all South Africans who qualify from the age of 12 now, as will be restated from time to time, updated from time to time. Please take time to inquire if you're not sure at your nearest health facility to find out Dr. Leslie Bamford. So again, just to say we can overcome, we can remain stable and even get out of the pandemic if we work together. Thank you very much, Foster.
Honorable Minister and members of the panel for providing that comprehensive feedback that the country and the media will continue to take them through a normal media interview. So on this note...
Thank you, Mr. Foster. Minister, I would like to thank you very much for the foresight that you have had in actually calling this media brief. It was also much more emphasized, also you recall in the meeting of the morning when you were actually briefing the NCCC. A lot of government leaders were very happy that you called that meeting to just allay the anxiety of the people in the world and people in our country, to say, some of them were even saying they were expecting you are going to be very hard on us, but very timely to come to this space and actually get to our leadership, the president and all the ministers, and now at this platform. It has really helped us a lot. We now know that South Africans really relax, go back to their work, go back to schools, knowing that we must continue with the precautions that we take. And I think the emphasis that the minister is making must actually be the one that is guiding us. Provoked by one of the questions to say, why do we vaccinate when you know that you still get an infection? But it actually, the caller should actually said, you don't go to the ICU when you are vaccinated, and you don't actually have I want us to say to South Africans, yeah, do use the mask as an option. Sometimes I do wear it when I actually more protecting other South Africans around me, when I have a flu-like illness, and remain that way, optional, not compulsory. Let's move on. And thank you, Minister, for supporting and guiding us as a country in this regard. Over to you, Foster. Thank you very much.
Thank you, Honorable Deputy Minister and the members of the panel, which has been detected recently. We believe that we'll continuously provide the public with the information as far as COVID-19 situation is concerned, including other pandemics or health conditions like measles that we continuously urge the parents, the caregivers with this media briefing agenda, but they will continuously do the media interviews as per the request. Thank you.
Thank you very much. Bye-bye.
Bye-bye.
Thank you very much. Goodbye.